So we have new data here. We have always seen, first of all, I want to re-emphasize our vaccines are working just as we thought they would with the Delta variant to prevent severe hospitalization and death. We should be getting vaccinated to prevent severe disease in ourselves and to protect ourselves from the Delta variant and from getting severe COVID. Here's the new science that we saw just in the last several days. With prior variants, when people had these rare breakthrough infections, we didn't see the capacity of them to spread the virus to others. But with the Delta variant, we now see in our outbreak investigations that have been occurring over the last couple of weeks, in those outbreak investigations, we have been seeing that if you happen to have one of those breakthrough infections, that you can actually now pass it to somebody else. We thought that was really important for people to know and understand, because when people are out there vaccinated thinking that even if they get mild illness, they can't give it to someone else, if they're then going to a loved one who's immunocompromised, who isn't yet vaccinated or couldn't yet be vaccinated, we wanted them to take the protection to protect others. So that was the new science that prompted the guidance, and it was not. It weighed heavily. I know that this is not a message America wants to hear.
And what they saw with Delta was a change in that data. Delta behaves differently. And when the data changed, they changed their recommendations. This is actually what you want to happen with science. You want science to be dynamic. You want recommendations to reflect the latest science. And that's what you see in the recommendations that were issued today.
We were dealing with the alpha virus back a few months ago. As I told you, it was a virus that if a person had a breakthrough infection, very, very unlikely that that person would transmit it. That's changed. Now, the level of virus in the nasopharynx of an infected person with Delta is 1,000 times of what it was with the alpha, which means it really has the capability, and in fact, in the real world is doing it. It can transmit. So nothing changed about the science. It was the virus that changed. We're dealing with fundamentally a different virus. When you get vaccinated, you don't get vaccinated just because you don't want to wear a mask. You get vaccinated because you want to save your life. Your own health is the reason.